And so if you're thinking about building your own private medical practice, your own online medical practice, virtual medical practice, your physical medical practice, your hybrid medical practice, it's necessary for you to understand a certain few things about the insurance world versus the cash pay world, sometimes called the fee-for-service model. I've reviewed this topic many times before. Obviously, the insurance system works because you have a bunch of people signed up under a monthly plan with an insurance company. And this insurance company will then send these people, basically it's a huge funnel that sends these individuals to various medical groups and medical offices. And in order to do that, the insurance company must make sure that it's in their favor to do that. And so they're going to negotiate some rates with the physicians. So a classic example, recently I did a coaching call with a physician out of Florida, and she had an incredibly difficult time contracting with different insurance companies. So essentially all the Blue Shield, Blue Cross, and even some of the Medicaid providers were basically telling her, no, we're not going to contract with you unless you are part of a large medical group of physicians. If you're a solo dermatology provider, we're just not going to contract with you. So essentially she couldn't find a good way to start this practice with only an insurance model. Fortunately, she pivoted, and with some good ideas, I think she's able to make it work just doing a cash-based practice. But I mean, the insurance company has the option of not contracting with you or renegotiating your contracts or saying that you must do it this way or that way. And if you don't do it, then there might be some consequences. So oftentimes what happens is an insurance company, let's say Blue Cross, everybody knows that one, will contract with you. And they're going to say, look, we're going to have this many patients that are going to come to you and you must see them, and this is your obligation. We're going to pay you about this much per visit and this much per this kind of visit. And so that rate gets negotiated. If your patient population happens to be a lot sicker, a lot more complicated, or if your patient population happens to be a lot easier, well, of course, you could go on either side of this coin. You might have a lot less time per patient and still profit a lot, or you might have very complicated patients and still get paid the same amount. And you're going to get paid the same amount regardless of how complicated a patient is. So that's the insurance world. Essentially, it guarantees a medical office a new burgeoning medical office, a guaranteed inflow of patients. And in some ways, of course, that's really good when you're a new provider, a young attending coming out of training, but it's not good when you want to grow. And a cash-based practice is different. You got to go find these patients. They're not all in some insurance company because the insurance company says, okay, I gave this Blue Shield, Blue Cross card to Mrs. Smith, and your name, Dr. Mohammed Ashori, is listed. And so that patient can go to, Ms. Smith can go to Dr. Ashori because Dr. Ashori is very close and he'll take her insurance. Well, that's great, right? So it's kind of this funnel of all these patients coming in. If you have your own medical practice, you got to advertise yourself. You got to find Mrs. Smith. Somehow you got to reach out to her. And there's many ways of doing that, of course. The specialists have figured out that they can go to the primary care doctors, and private practice primary care doctors, the cash-based primary care doctors, have learned that they can actually go to the physical therapists and nutritionists and other holistic people nearby who still have patients that are interested in this kind of care, in the cash-based care. So to make it worthwhile, we have to be able to provide something outside of the traditional insurance system. If you are a private practice doctor who's going to go and charge cash per patient, whether monthly in the direct care model, direct specialty care, direct primary care, or whether you're going to do a fee for service for each visit, I'm going to charge you $200, $150, $75, or you're going to do some other membership plan or some other hybrid plan or a coaching package or a health package. You have to understand that you cannot deliver the same things that we deliver in the insurance world. People are not looking for that. People are looking for something quite unique, quite different. And to do that, you have to first start with your prices. What prices are you offering and what value are you giving the patient? If it's just a 7 to 10 minute visit, well, then you should charge very little money for that, right? And of course, you're going to make your money up in volume. But if you're going to sit down for an hour with each patient, you can't just charge the normal $120, $130 that Blue Cross is going to reimburse you or Medicare is going to reimburse you per patient, it's probably not even that much, like $90. You're probably going to have to charge double that, triple that. And of course, a lot of people can't afford that. But the question is, can you afford staying in the insurance-based model if it's burning you out or if you're not offering any value to these patients? And that's always a deeper discussion that I know that kind of gets lost in social media, because many people will say, well, look at you spending an hour with patients. That's not, it's not sustainable for the health insurance model. When in fact, the health insurance model is a big behemoth and it can take quite good care of itself. And if the politicians and insurance providers would like to make it more patient-friendly, they're more than welcome to do so. Me, as a single physician, I'm probably not going to have a major impact. So I would rather just see the kind of patients in the model that I like to. So the next piece of this discussion is finding these patients, and that's the marketing. A lot of physicians go into this world and they think that they're going to just open up a shop with good street signage, meaning you have a good sign above your door and people are just going to come flocking to you. That's probably not the case. A lot of people are now going to go to maybe the local large medical group, right? They're going to pass past your place and they're not going to recognize that you're even a doctor's office. If over time you stay there long enough and you can supplement your income with other things, sure, after a while word will get out and people will recognize that you're a local community physician and you offer really good care. But in the beginning, you're probably going to have to supplement your income. However, the beauty of it is that if you do hang your own shingles, as they say, chances are you can offer a lot of variety in the beginning. You can do walk-in consultations, you can do free consultations, you can do regular walk-in care for general primary care stuff, you can refill a few medications. In that time, you'll have discussions with these patients and you can decide if you want to enroll them as part of your direct care practice or your membership practice or your fee-for-service practice or your concierge practice, whatever it is that you like to run. Don't let anybody tell you that your practice is not going to work or this isn't going to, nobody goes to concierge. Everybody has their own opinion, but chances are that you're going to be able to still make a good amount of money as long as you're offering value to the patient, and the patient has to be able to understand that. In the insurance model, it's quite obvious what they're getting. They're getting access. That's the best they can hope for, is that they're going to get access, right? And so they're going to use their insurance card, like, I know at least I can get a freaking appointment over there and this guy's going to take my insurance card. But in the private practice, the cash-based world, you're offering a lot more. You're offering that personal touch, the good connection, me showing up with fairly good, what do they call it? Like, you're all like put together well, I'm clean, I communicate well, I listen to you, I make eye contact, and I listen, and I make eye contact, and I discuss and ask questions, and that's what you're paying money for. And then after some time, the patient is able to open up and they're going to ask better questions and hopefully they're going to improve, and then they're going to bring their family to you and they're going to refer their friends to you. That's a very different service. So we, as physicians who go into the private practice model, have to understand that it's because it is such a different system, we have to practice differently. If you're in the traditional insurance system, your margins are incredibly low because you're going to run a practice based on a huge overhead, multiple employees, a billing practice, an electronic health record that meets the requirements of the insurance company, many legal documents that patients have to sign, many prior authorizations, a lot of time that you have to spend on administration. Buddy of mine owns many fast food restaurants, and those fast food restaurants have a very low margin, meaning that let's say you make $1 million, maybe only $100,000 or $150,000 is yours. Everything else goes to corporate, goes to marketing, advertising, hiring employees. So the margins are very low. And we could say the same thing about buying a commercial piece of real estate. The margins on the profits might actually be very low. You might spend $2 million, but you might only make like $55,000 a year. Of course, there's many ways to measure that kind of investment. In a medical office, an insurance-based medical office, 25% is pretty good. And that's really tough when you think about it. Like, what are we spending all that time and effort on the insurance company, the medical group, malpractice, admin, employees, office supplies. But the patient is not getting any of that. And we know that right now, administrative burden is growing and growing and pushing out the doctor and pushing out the patient. Conversely, on the other flip side of the whatever, a private medical practice, a cash-based medical practice, doesn't run on thin margins. It actually has a much wider margin. Now, of course, some administrative tasks have to be in there, but it's very little. Some bureaucracy has to be there, but it's very little. Some overhead expenses and things like that are going to be there, but they're going to be a lot less. So the majority of what you're doing for the patient goes directly to the patient. Very little of it gets sucked out. Very little value gets sucked out. So the patient gets the majority of it. Now, are patients going to recognize that? No, of course not. You're going to have to convince patients that this is a great opportunity for them. You're going to offer much better value, and you're going to give them the kind of care that they would never get in an insurance-based practice. Now, there's a few ways about that. One, simply increase access, right? You might just go after the insurance-based people and just say, look, I'll just get you in right away. You can get same-day appointments with me. That's value. You can say that I'll give you all the medications that you want, of course, with, you're not going to give them, you're going to give them the antibiotics, you're going to give them the pain medicines, not the narcotic pain meds, but you're going to give them pain medicines, you're going to give them the creams and the aesthetic stuff and all that stuff. So you're giving them everything that they want. And the third one might be that you're just going to listen and you're going to be really nice, especially for you specialists. That's a huge one, because a specialist in busy practices can be a bit dismissive. So you are basically giving them a lot of access, or two, you're you're giving them a lot of medications, and three, you're really listening to them. You're being super, super kind. Of course, my idea is that you just try to practice really good medicine. The problem is, really good medicine often means that you just have to talk a lot with the patient and educate them and empower them. And that means that they're going to have to do a lot of the heavy lifting, and a lot of people may not be interested in that. But you'll see that maybe 10% of 10% of 10% of people are actually into that. So if that's the kind of model practice you want to run, if that is the way you manage your health, that might be great. If you're the kind of person who generally just wants to get into the doctor as quickly as possible, you probably should offer that initial thing where, look, we just got appointments for you. You can come in and see us really quickly. And that's our cash-based value system that we offer you. And if you're somebody who's like, look, when I get a migraine, shit, man, I want my mag shot, I want my Imitrex, and I want my prednisone, and I want my lorazepam, and I'm good to go. Like, I know my migraine's going to be gone. Well, then you need to be in that middle space where you're just giving people a lot of meds. And then, of course, if you're somebody dealing with chronic medical conditions and you just want your doctor to listen and really analyze, then you got to be in that third category. And if you're someone who's a bit more of a biohacker and health maintenance guy and preventative person, then you should be into this kind of category that I'm in with my patients at drrashori.com. And of course, it's different for everyone. You're not going to be able to serve all these patients really well. Anyway, I hope that makes sense. I hope you understand the differences between a private medical practice that's cash-based and an insurance one, and why they operate on different margins and how to think through it. Take care, guys.